Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we'll explore a fascinating topic that goes beyond the usual understanding of diabetes, how it affects cognitive health, and how environmental factors like artificial light can impact overall diabetes management.
That's right, Emma. Type 2 diabetes isn't just about managing blood sugar anymore. Recent research shows that it can lead to cognitive decline and even dementia in some cases. It's important for both healthcare professionals and patients to be aware of these connections because they can significantly impact the quality of life. Today, we'll explore these insights and discuss how environmental factors like artificial light exposure can further complicate things.
Let's start with the cognitive effects. Diabetes is often thought of as a physical condition, but studies are now showing that it can affect cognitive health. Alex, can you tell us more about what researchers have found?
Cognitive impairment in type 2 diabetes can manifest in various forms, from mild decline to severe dementia. A study involving 152 patients used fuzzy clustering to identify three distinct cognitive clusters. The severe non-amnestic group performed the worst in areas like decision-making and attention, and this group was mostly composed of women with longer durations of diabetes and lower educational attainment.
So it's not just memory loss we're talking about here. These patients face challenges with executive functions like attention and decision-making, which makes daily life more difficult. And then there's the amnestic cluster, right?
Yes, the amnestic group experienced memory impairments, but performed better in other cognitive areas. This shows that diabetes-related cognitive decline isn't uniform. Different cognitive functions are affected depending on multiple factors, like the patient's educational background, diabetes duration, and even biological markers such as iron or hemoglobin levels.
That's important for healthcare providers to know, as personalized care becomes crucial. Depending on the patient's cognitive profile, different interventions, like cognitive training or nutritional support, can help maintain cognitive health. Now, let's shift to something we might not normally think about: environmental factors. One that's becoming increasingly important is artificial light at night. Alex, how does artificial light exposure affect people with diabetes?
Great question, Emma. Artificial light at night disrupts our natural circadian rhythms, which regulate everything from sleep to metabolic processes. In people with diabetes, this disruption can worsen glucose regulation and lipid metabolism. A study conducted in China involving 1,765 individuals found that exposure to outdoor artificial light was linked to poorer cardiovascular health in people with diabetes.
That's incredible. It's almost like the light pollution we're exposed to in cities is contributing to worse health outcomes for people managing chronic conditions like diabetes. But can this be addressed with lifestyle changes?
Absolutely. Simple modifications like reducing artificial light exposure in the evening, improving sleep hygiene, and focusing on regular physical activity can help mitigate these risks. It's important to integrate environmental factors into diabetes care, as light pollution is expected to increase with urbanization.
Going back to cognitive decline, this isn't just about one or two risk factors, is it? It seems like cognitive decline in diabetes is influenced by multiple elements.
Exactly. It's a multifactorial challenge. Cognitive decline in diabetes is affected by a combination of genetics, comorbid conditions like hypertension, and lifestyle choices. For example, the study I mentioned earlier found that patients with lower education levels and longer diabetes durations exhibited higher rates of severe cognitive impairment.
And this decline affects the ability of patients to manage their diabetes, doesn't it?
That's right. Cognitive impairment can make it more difficult for patients to manage their diabetes, leading to poorer health outcomes. Early screening and intervention, especially in at-risk populations, can help improve cognitive health and overall diabetes management.
Let's go back to artificial light exposure. What can healthcare professionals do to mitigate its effects for people with diabetes?
Reducing exposure to artificial light at night should be a part of public health strategies. Promoting responsible outdoor lighting practices, especially in urban areas, could help reduce the negative health impacts of light pollution. And encouraging patients to prioritize sleep hygiene, along with regular physical activity and a balanced diet, can improve both metabolic and cardiovascular health.
That's such an actionable step for improving health outcomes, not just for diabetes, but for overall well-being. It shows how interconnected environmental factors are with chronic conditions. Now let's move to another important topic: body composition. Alex, how does body fat variation affect the risk of complications like diabetic nephropathy?
Recent research has shown that high body fat variability is linked to a higher risk of developing diabetic nephropathy, especially in people with obesity. The study involving 4,609 participants found that those with obesity had a stronger association between body fat variation and nephropathy, suggesting that maintaining stable body composition is critical for preventing kidney damage.
So, managing stable weight is just as important as losing weight for people with diabetes. It's about consistency in body composition to avoid serious complications. Physical activity is always part of the conversation when it comes to managing diabetes, but it's particularly important when looking at risks related to prediabetes and diabetes. How does it modify these risks?
Physical activity plays a key role in modulating metabolic health. A study involving 2,220 participants found that individuals with low levels of physical activity had a substantially higher prevalence of prediabetes and diabetes as their atherogenic index of plasma, AIP, increased. In contrast, those engaging in moderate to high levels of activity saw a significant reduction in these risks.
That shows how exercise is one of the most effective ways to combat the progression of diabetes, especially for people at risk of prediabetes. Gut health is another critical factor in diabetes management. The microbiota in our gut plays a significant role in regulating metabolic processes. How does it impact diabetes?
The gut microbiota, comprising trillions of microorganisms, influences everything from metabolism to immune responses. In people with diabetes, an imbalance in the gut microbiome called dysbiosis can worsen insulin resistance. Certain bacteria, like Akkermansia mucinifera, produce short-chain fatty acids like butyrate, which help regulate glucose metabolism and reduce inflammation. A high-fiber diet is essential for maintaining a healthy gut microbiome and enhancing these beneficial bacteria.
It's amazing how interconnected our gut health is with the rest of our metabolic functions. A fiber-rich diet can support not only gut health, but also improve insulin sensitivity and reduce complications. Now for one of our favorite parts, herbal remedies. We've put together a holistic formula specifically designed to address the complex challenges of type 2 diabetes. Alex, walk us through this blend.
This herbal formula is carefully crafted to enhance insulin sensitivity, regulate blood glucose, and reduce inflammation. The first key ingredient is berberine. It mimics the action of pharmaceuticals like metformin, activating AMPK pathways, which help regulate glucose uptake and reduce blood sugar.
That's great. Cinnamon is another powerful component in this formula. It improves insulin sensitivity and may even help lower fasting blood glucose and HbA1c levels.
Absolutely. Next, we have Gymnema sylvester, which works by reducing sugar absorption in the intestines. It also supports insulin function, making it ideal for glucose control.
And then there's turmeric, a known anti-inflammatory. Its active compound, curcumin, helps reduce chronic inflammation, which is common in people with diabetes.
Yes, and fenugreek is rich in soluble fiber and saponins, helping to lower blood sugar levels and improve glycemic control. Bitter melon is another key player. Its compounds, charantin and polypeptide P, enhance glucose uptake and improve insulin sensitivity.
This is such a comprehensive approach. Green tea extract also provides antioxidants like EGCG, which support insulin sensitivity and help reduce the risk of kidney complications.
Let's not forget holy basil, which helps reduce stress-induced hyperglycemia. Its adaptogenic properties make it perfect for stabilizing blood sugar during times of stress. We've also included probiotic supplementation, including Akkermansia mucinifera, to balance gut microbiota and reduce systemic inflammation.
And lastly, roselle helps lower blood pressure and improves lipid profiles, thanks to its rich anthocyanins with antioxidant properties. It's clear that this formula not only targets blood glucose, but supports overall metabolic and cardiovascular health. We've covered so much today, from the cognitive impacts of diabetes to the influence of environmental factors and the role of gut health. It's clear that managing diabetes goes beyond controlling blood sugar. It requires a holistic approach.
Exactly, Emma. By considering cognitive health, body composition, physical activity, and even artificial light exposure, we can improve the quality of life for people managing diabetes. And with the right herbal support, like our formula, patients can take proactive steps towards better health.
Thanks for joining us today, everyone. For more information on our herbal formula and other resources, visit us at herbalbloom.org. And as always, take care and stay healthy.